It was just a funny little finger rolling thing, and then an awkwardness with putting on his coat, stuff like that, and a slight tremor.
As a matter of fact, I would look at myself in the mirror and say, Debbie, you have Parkinson's. Debbie, you have Parkinson's. And it took a while for me to understand what that was all about.
I was playing piano professionally. I started to have some difficulty, which I thought I'm not practicing enough. Basically, my left hand couldn't keep up with my right hand.
My mother passed away from complications due to Parkinson's. When I witnessed my mom unable to eat, had to be fed through her stomach or unable to talk, the vision of that being me someday it still is very difficult for me to reconcile with.
In 2007, we were very fortunate to receive support from the Edmond J. Safra Philanthropic Foundation. And the idea was to partner with an excellent community agency to form a medically connected, community-based Parkinson's wellness program. So NYU reached out to JCC in Manhattan and said, we have an idea. The idea was to provide exercise classes, support groups, educational and networking events in a community space.
We were approached by the National Parkinson's Foundation to be among the first 2 teams to try to replicate the New York project.
We really promote wellness programs and recognize the benefits, both seeing it on an individual patient-by-patient basis and the research studies that clearly document benefits in terms of improvements clinically in patients who participate in these. So the opportunity to expand it through collaboration with the JCC was something we were thrilled to take part in.
This fits right into who we are as a JCC, what we do as a JCC. It's right in our wheelhouse.
We already have programs at Beth Israel, but we were coming into an organization that we knew nothing about, and they have embraced this from the bottom to the top.
The Deaconess Medical Center is a tremendous partner in this effort. And nationally, the Safra Foundation and the National Parkinson's Foundation, putting those partners, their resources, their expertise, their experience together with what we can create locally makes this just a partnership that could probably not be even imagined by the people who are participating in these programs.
I was immediately attracted because I wanted something that was structured, that was reinforcing, that was positive, that was going to encourage me to try as hard as I could try.
When we first started the program, we were like, wow, they're having a hard time walking into the studio. As we went through the program and through the months, you would see people come into the studio having a difficult time walking, but by the time they finished the class, they were feeling energetic, walking straighter, more confident than when they came in.
I'm taking them because I want to be able to do what I want to do. I want to maintain and be able to do what I want to do. But recently I realized that the classes are also what I want to do. They're not just a means to an end. They're so fun.
I breathe better, I sleep better, I'm more relaxed. I look a lot better. I'm not trying to be funny about it, but with all the physical efforts that we put into it, we finally show. We look good on the beach.
It's like a little club that you might not want to be in, but boy, I'm in it. And everybody's really pretty nice around here, and they know so many things. It was like a warm hug. It was like, come Debbie, come and let me help you.
Really is like his Parkinson's progressed 5 years in 3 days.
There's an old adage that when one is sick, 2 need care.
In recognition of the caregiver stress, we supported the idea of setting up this separate caregiver support group that runs concurrently with our wellness programs at the JCC.
I jumped at the chance to be able to talk to other people who are in somewhat the same situation as I was.
They can talk, they can be honest, they can be authentic, they can share their fears, their hopes, they laugh together, they cry together.
I get overwhelmed, and I've started to recognize that sometimes it's caregiver burnout and sometimes it's just who we are, and we can laugh, or we try to laugh and get past the bad moments, you know.
I've cried, I've ripped out my hair, I've lost my patience, I mean, it's been very difficult.
It's an amazing hour that we spend week after week.
In looking back, I find it interesting that this type of programming really only existed piecemeal throughout the community. We have built a community center that really caters to the Parkinson's population.
Beth Israel, I've been working on clinical trials for 7 years. I've been in my position. And for 7 years, we start out these trials hoping that we're going to give people something that will slow the progression of their disease, hopefully cure their disease at some point. The JCC, people go in and they cycle for an hour and they come out of that class having done something for themselves, and it's given them a hope that I can't give them with the clinical trials.
Everybody knows that you need to exercise. Not everybody is doing it. It's great to be with a group that knows they need to and they're doing it.
We have learned to smile and laugh again.
It's afforded me the luxury of liking myself a lot better than I did before.
Do I necessarily feel like I won't succumb to complications from Parkinson's 20 years from now, like my mom? No, I'm a realist. Maybe by leading a much more active, a much more positive thinking, a much more inspired life, one of the byproducts of all of that may be that my life will be much better than it otherwise would have been.